Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office. I'm joined here today by Barb Hope, Director of the St. Clair County Health Department, and Susan Sarfady, our Regional Superintendent of Schools, and Chairman Kern will be joining us shortly. Barb, we've got numbers today, but we've also got some important information that needs to get out about the schools. So why don't you lead us off with that information?
Absolutely. And again, as we've been talking about for months, this is one of the best things we had to protect ourselves against COVID. So just a reminder, please wear your mask and do the 6 foot of distancing. As Susan Sarfady, our Regional Office of Education, is with us today. And today, the governor announced that St. Clair County is one of the 13 counties at warning level for the coronavirus disease. Our stats for St. Clair County itself have gone up from an 8.3% positivity rating to an 8.6% positive rating. And this is specifically for the county for the last week. Our cases per 100,000 have gone up from 165 per 100,000 to 176 per 1,000. Our numbers for age groups, especially youth, those school-age children, the number of positive cases for that age group has gone up. And with that, over the last several weeks and months, we've been in conversation with Susan and the school districts, superintendents, principals, and other agencies, along with our sister agency, Eastside Health District. And we today, after reviewing all these statistics, also working with IDPH and the school districts, we today are advising that schools, if possible, they strongly consider going remote to start the school year based upon these scientific facts. So Susan, if you want to talk a little bit more about this, how we've worked with the schools and what this means for the region.
Oh, sure. Thanks, Barb, and thank you for what you do every day. Our schools have been, and superintendents and principals and teacher teams have been working for months on plans on how to return to school safely. And every time we get more guidance from either ISBE or IDPH, they relook at their plans and they reevaluate and they tweak and they change. And that's what's going to happen today and over the weekend. I know that every school district in our county and every non-public school in our county has a plan. They either have it posted on their website or it's been sent to parents, but they are going to be looking at what they're doing in light of your guidance this afternoon, and that came out it hasn't even been released yet to the public. Right. But they're going to look at what they have planned. Are they strictly following the IDPH guidelines? Can they still meet in person, or do they need to go remote based on your recommendation? If there are any changes to the plans for your particular district with your child, it will be communicated to you. So please listen for however your district communicates, whether it's an email blast, a phone call blast. There are multiple ways, social media, that if there is a change, you will be notified as a parent in the district.
Absolutely. And I know we've been working very, very hard together, and this is based upon our scientific evidence as we know it today. Things change on a daily basis. This virus we don't have a cure, we don't have a vaccine, and at this time, scientifically, especially when the governor's announcement today of saying, we're one of 13 counties at the high warning level across the state. We want to protect our children best we can.
And so do our superintendents and principals. That is their first and foremost thought, is taking care of kids and making sure that students are safe and that teachers are safe. And so they're looking at their protocols and what they already have planned and determining whether they need to change that or not based on their particular plan for their particular school with their particular needs.
And that's a very good point, because each school is different. Schools have, the size of their school, the layout of their school, how many students they have. Some of the schools have a lot smaller classrooms, so they can possibly meet all the distancing requirements and things. But again, each school is different, but it's up to each district how they want to manage it.
Right, and the age level is different. If you've been watching this show over the last 2.5 weeks, when we've had different superintendents sitting in this chair talking about how they're going to do kindergarten through 8th grade versus high school, you will have seen that is a very different plan for younger children and older children, which isn't a surprise if you've raised kids or been around kids for any length of time. A 16-year-old looks different than a 6-year-old usually.
Sure, this is
But
true.
you know, you have been sitting here and Sam has been sitting here talking about the numbers, and over the last couple weeks we're seeing almost every day when the numbers are announced of new positive cases, you're including under 10 years old in that count. And so, and also we've also been talking about the increase in the under 40 age level people testing positive, and those are our parents. So we have to be looking at those numbers. We have to use science. This is not an easy decision for anybody, and none of our superintendents are having a good time.
No doubt, no doubt. And I know they're working very hard, and they had plan A to Z to try to figure out what's the best solution for their school, for their community within their district. So absolutely. And again, we strongly encourage the schools to evaluate their situation on their own basis. We are not saying schools can't open. We're not saying that at all. Each school is different, so we're strongly encourage them to look into possibly remote learning if they can't meet those guidelines.
And I will guarantee you that each superintendent has the ISBE guidelines sitting on their desk, highlighted, circled. They know what the state board is asking us to do.
And those guidelines are how thick and which revision?
The last one we got was 103 pages, and that
Yes.
was the third out of 3, obviously.
Yes, very much so. Well, Susan, thank you. Thanks for working together with us. Again, as Susan said, please check with your school for what their plans will be. We know some schools are starting next week and the week after, so we're trying to get out ahead of this as fast as we can. We worked with IDPH. We have been promised that we will be getting written guidelines for future decision making on the metrics to be able to evaluate. But the current statistical information, the science that we have, that we based this statement on, is at the dph.illinois.gov website, and you can drop down where it talks about county metrics, and then put in St. Clair County, and you can see the specifics, these actual numbers that we're talking about, and those are updated on a daily basis. So again, thank you, Susan.
Thank you.
You're welcome. Also today, the governor spoke at his press conference this morning at 9:30 and talked about emergency rules, public health rules, to enhance the Board of Health's authority to protect the public. Part of that is with protecting the public by the authority to have regulatory authority, legal authority to protect the public or the public's imminent health, which will include masking for the employees, and they're asking businesses to make sure that all employees and their customers wear masks. And then we'll be following up more with that when we see those emergency rules in hand. As I announced yesterday, as we looked at our ordinance, we're already in that mode and putting out notices to all the food service facilities stating that you must wear masks. You cannot put the public in an immediate public health hazard. So we'll send you a warning. We're sending the notice. If we have violations, we'll send you a warning, and then after that, we may pull your food permit. More to follow on that. So please, this is again another way that our community can control the spread of this disease. As far as numbers today, again, as we said earlier, our numbers are increasing. Today we had 53 new positive cases, both males and females, and I want to emphasize that several of these cases were teens, as well as those up to 70 years of age. We had a total of 42,575 tests we've done so far, so that was 1,113 additional tests we did with those 53 new positives. And fortunately, no deaths to report today. But again, the 157 total we have for the county is 157 too many. So we're trying to make sure we're doing everything we can to control the death rate. Statewide, the state has tested 2,984,618 tests, and of that we have an increase of 2,084 positive cases for a total of 190,508. Unfortunately, today the state of Illinois is reporting 21 additional deaths due to COVID. Again, this disease is not going away. We see this every day, and we all need to get in and do this together as a community to help control the spread of this disease. Hospitalization numbers in St. Clair County, we have 41 patients that are hospitalized due to COVID-19 related illness, and we have an additional person on a ventilator. We have a total of 3 on a ventilator as of today. In our congregate settings, we have an additional case of COVID in the Caritas Family Solutions in Belleville. We have an additional case at the Caseyville Nursing Home, and also an additional case at Cedar Ridge in Lebanon, for a total of 78 cases there. Again, yesterday we had testing clinics. In the morning we were in Fayetteville, where we had 107 tests conducted, and then in the afternoon we were in Freeburg with 159 tests conducted. It was a huge turnout, a huge crowd, so we did a total of 266 tests yesterday that we'll be getting those reports as soon as we can back to those individuals. Next week, please check our website and Madison County's website as well. The Department of Public Health has several mobile clinics going on next Monday through Sunday. They will be in Madison on August 10th. They'll be in Collinsville on August 11th, Alton on August 12th, and back in Madison on August 13th, Highland on August 14th, in Alton on August 15th, and on August 16th they will be in Edwardsville. Again, this is open to anyone in the state of Illinois that can go get tested at these sites. The next week, the 17th, 18th, and 21st of August, we'll have more Department of Public Health testing sites in St. Clair County as well. So we'll have more information. Check our website or check the EMA website for that additional information. Okay? And that is what I have today.
Thank you, Barb.
What do you
Appreciate
think, Herb?
it. I think it's been a long day, and I know
It's been a long day and a long week.
And you're going to be looking for the weekend, but I know where you're going to be at.
I'll see you Sunday.
You're going to be here Sunday.
I will.
We appreciate the work of you and Susan, and I know it's decisions have got to be made, and we've said that all along. This thing is changing sometimes by the minute, by the hour, by the day, and it's just proven today. We've had those superintendents and school administrators in over the last week and a half, and the one thing is they've all said they're able to adjust, and so now we're going to put them to the task and see if that happens. So
Absolutely, and again, all along, you know, they've had those different plans, and this is the best of what we know at this time based on scientific evidence.
And
So,
every one of them that's been in, I mean, they've all said the same thing. You know, it's got to be about the safety of the children and of the staff members, and I think that's just the way it's got to be. And we've come to learn we're not going to make everybody happy.
Absolutely.
We're going to do what's best, though, for the public safety.
and again, one thing I want to reach out, and this is for the safety of the students and the kids and the parents as well. But kids, because if your school is going to remote learning, that doesn't mean being running around with your group without wearing your mask. You're going to defeat the purpose. They have to understand they're part of the solution. They have to wear their masks, so even though they feel fine, they could be asymptomatic and carrying disease and carry it home to their parents or their grandparents or their friends. So again, we need to make sure everyone, no matter what your age, that you're following these masking, social distancing rules.
That's exactly right. Joined here now by Chairman Kern.
Yeah, Herb. And Barb, I find it odd that Illinois Department of Public Health is going to do 7 days of testing in Madison County when St. Clair County really is where those warning levels exist, not in Madison County. And then the following week, they're going to do how many tests testing days in St. Clair County, 2 or 3?
We have 3 set up in our
3.
county, and then we have a couple additional we're trying to set up with other agencies.
I mean, hopefully, Illinois Department of Public Health will take a look at the counties where they're seeing the uptick and actually test in the counties where that exists, rather than given 7 days of testing in a county that isn't on their warning list. That's why we're encouraging St. Clair County residents, you can utilize the testing centers in Madison County. So go to those sites, get tested, but really, it would seem to me that the proximity should be tested in the counties where they need that. And you issued that guidance today really in lieu of a state policy to the schools. Is that correct?
We issued this, we're reviewing guidance and in consultation with Department of Public Health for metrics that they're working on to be released here in the near future. But we have school starting Monday. And I've been discussion late last night and all through the week with Department of Public Health and their officials and epidemiologists and things, to ensuring that the way we're going, and with our county being orange, our positivity rate being above 8, we're at warning levels at a couple of statistical guidelines in that matrix that we're above that. So our recommendation is, and it's the best we have at this time.
And some schools are opening Monday. I don't know when Illinois Department of Public Health was going to issue their guidance, but it seems like you can't do it at Christmas. They need to be issuing that right now. So.
Well, again, and that's why Eastside Health District and I, Liz Patton and I got together and said we need to take care of our kids now, and it's a unified message to the schools that we have in St. Clair County that if you can't do the masking, you can't do the social distancing, because schools are crowded and it's hard to get people 6 foot apart. I mean, we're spread out 6 foot or more apart here, but that limits your capacity, and that's hard to do in a school.
So, and one more thing. So, but we did have some good news today. Yesterday, the daily county positivity was 7.6%. Today was 4.8%. So we did go down in numbers from 95 yesterday to 53 today. And we tested virtually a similar amount, maybe a few more, a couple hundred more yesterday. But still, those numbers appear to be much better off today percentage-wise.
They are, and we report those numbers as we get the actual laboratory results in our, we call it INED system, in our state reporting system. So we actually have the lab reports to say, this is how many were turned in today as positive, this is how many were turned in today as negative. So that's a daily rate based on that lab submission.
But that's what we're given. That's the best information that we can get, which is really why you do a running average as opposed to look at every day. But that's what we have to look at. So when we get it down day, I think it's important to give people a pat on the back, because obviously something's working when those numbers are going down.
Absolutely. Absolutely.
Thanks, Barb.
You bet.
So we'll move into the zip code report at this time. These are the COVID positive individuals in these particular St. Clair County zip codes. If the number goes up, it's because there's more COVID positives. If the number goes down, it could be because there was a transfer in between zip codes. A number of different issues cause us to take a zip code down a notch. And we do that because we want to have the most accurate numbers available to you. So today in 62059, we remain the same at 10. In 62201, we go down by 1 to 189. 62203 goes up by 1 to 156. 62204 goes up by 3 to 119. 62205 goes up by 3 to 161. 62206 goes up by 1 to 354. 62207 stayed the same today at 204. 62208 goes up by 1 to 275. 62220 goes up by 4 to 351. 62221 goes up by 7 to 379. 62223 goes up by 9 today. They surpassed the 200 level at 202. 62225 stays the same at 17. 62226 goes up 7 to 440. 62232 goes up by 1 to 90. 62239 goes up by 2 to 53. 62240 goes up by 1 to 17. 62243 goes up by 2 to 32. 62254 also goes up by 2 today to 130. 62255 stays the same at 13. 62257 goes up by 1 to 23. 62258 goes up by 4 to 73. 62260 goes up by 2 to 64. 62264 goes up by 1 to 70. 62269 goes up by 2 to 305. And 62285 stays the same at 39. Herb, I'm in Sam's chair. That is, it's a tough chair to sit in.
It's the hot seat.
It definitely is, but it's pretty far away from you. So
That's the good thing.
Your arm
we're
can't
way
reach
6
this
foot.
far.
And we hope Sam is enjoying a few days off, and we'll get her back here after a little rest that she so greatly needed. But we talked about testing, and I want to throw out there, because one of the things that we're always getting hit with over the head is the delay in the testing. And we said it the other day, it's not the health department that's doing the testing, it's the labs that are backed up, and it's not just in St. Clair County, it's all over the country. So for those of you people who think it's the health department that's delaying your test results, we'd like to have them test results back 10 minutes after you took it. And you would like to also, we know that. We have no control over that. I can assure you, Barb and her staff are doing everything they can. Liz at the Eastside Health District having to get the results back.
And our state representatives and state senators are advocating for more testing equipment to be located here in St. Clair County. So far, the state has not seen fit to bring testing equipment to our county, and so we're hoping that we can get that equipment. I know Larry McCulley is working at Southern Illinois Healthcare Foundation to see if he can't host such equipment, and we would welcome that for sure.
Well, and again, my point is we are trying to do everything we can on the county level. That's why we're here every day. One of the other things that I just briefly wanted to touch on, we get every day, people want to know how many people recovered from COVID. And, we post on there the quarantine day. The only thing that I can tell you, and before I tell you this, I want to give a shout out. I told the chairman that I lost 2 friends yesterday to COVID, to the Mudd family and to the Fillinger family. Dear friends of mine, condolences to the family. It really touches home. And then you turn around and you see people get on there and say, oh, they didn't die from COVID, they probably died from a car accident. Well, that's for your opinion. You got your head under a rock or something. So I can tell you, the people that I know that hasn't recovered from the COVID is 157 people, as I told you yesterday. Those are the ones that I can honestly tell you that didn't recover.
Right.
And we keep saying we don't want that number to go up. And the way we do that is, you heard Barb say, you heard the chairman say it, and I am so happy. Every day I see more and more people wearing their mask. I see more and more people practicing social distances, but we still have a good percentage out there that are flubbing their nose at it, saying, oh, it's not this, it's not that. Chairman talked yesterday about, you talked about letters that went out, and we're not just picking on the business people, but when we get the complaints here, we've actually got other law enforcement agencies, we've got other businesses that are calling us saying businesses aren't adhering to the masks, they're not requiring them. That's why you heard Barb say that they're sending out letters. The simple thing to do is take that as a warning. If I'm a business owner and I get a letter from the health department saying that, they had reports that I wasn't abiding by it, I don't want to shut my business back down. We're supposed to be open. That's what we want. We want businesses open, as we say every day. And that's the simplest thing to do. Because if we go backwards, you're going to be the same people complaining about, well, yeah, they shut me down. No, we didn't shut you down. The state didn't shut you down. You shut yourself down by not following what we're asking you to do. Proven scientific facts. I'm not the doctor. Barb's not the doctor. The chairman's not the doctor. But we've had doctors sitting in here that says, wear a dang mask. is the best precaution that you can do to help stop the spread of this invisible enemy. And that's simple. A couple hours out of the day, I bet any of you, unless you got a job that requires it. Brian, is there some questions I know you had? Anything going on?
No.
Okay, now off my rant. It's been a bad day, but we'll be back with Cindy and Daisy in a few moments to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon for the next daily briefing. Thank you.